Hi everybody, welcome to another edition of our Friday Live. I know it's been a few minutes since I've been in here, so I'm excited to share some thoughts with you all today. But first, while we give people a few minutes to log on, I will share a few reminders by way of announcements that we have happening in the very near future here at Fit for Life Physical Therapy. First of all, just a reminder that for the month of October, Joyce Amino, our personal trainer, is running a promotion for her personal training sessions. For a 30-minute session, it's $35. So feel free to reach out to her in the very near future. And if it's been something that you've been considering taking advantage of, this is a very low cost, low risk way of figuring out whether or not the two of you would be a good team to help you feel better as you move into fall. If you guys hop in here, please say hello. I think hi Jillian, seeing some friends. I can't see exactly who that is. Let's see. Yeah, it says Jillian. Hi, so just say hi if you guys hop in. I'd be happy to make this a little bit of an interactive Friday Live. So first is the fall promotion. Hi Carol. We're doing a little bit of announcements first. So Joyce Amino has the Friday or the fall promotions. That's the thing about the names. It's a little bit distracting, so I'll try to stay focused. And then the next announcement is for the month of October, we are honoring first responders with a special promotion. October 28th is First Responder Day. October is also National Physical Therapy Month. So Jenna and Raven and myself have been very busy the last few days visiting our local police and fire stations. So we hit Munson Township Fire, Chardon Fire and Police, Concord Fire, Eastlake Police and Fire, I think. The girls did some of them, but we have basically hit about 8 centers around our office and gave them a gift of a dozen donuts. We tried to support a local donut shop and then provided them with some coupons for half off their first physical therapy session. So if you know a first responder, or if you in here are a first responder and you've had a nagging ache or pain that's been keeping you down from living your best life, then this is precisely the time for you to take advantage of that. For those of you patients in here, also remember that we have an ongoing referral program. So whether or not that's a first responder in your life, you are eligible to, receive a little bit of a credit on your own account if you refer someone to come into Fit for Life Physical Therapy. That referral program gives the person that you refer a half off credit also. So they kind of are similar promotions. So first responders, thank you for your service, and please share that promotion with them. It'll be available at least through the rest of October. The final announcement I have is next Thursday, we are doing our community event. So the third Thursday of each month, we do at 7 to 8 o'clock, a free community event. This week, Raven will be teaching on sort of what the Transformation Challenge looks like. So for those of you that don't know what that is, there's a few ladies in here that did it last year for us. So if they want to comment, that would be awesome. It was something that we did in January, invited people to do it at the end of December. It was definitely more of like a health and fitness promotion. The girls did receive some physical therapy if they needed it, the ladies that did it. Raven did a phenomenal job with that program. It was a 12-week program, and both of the ladies did a great job reaching their goals. They were unique and personalized. We still found a way to make it a little bit of a challenge so that there was a winner, not based on points lost, weight or whatever, but just really sort of effort and participation kind of thing. But we are going to be launching that again at the beginning of January. This time we have some exciting new announcements, and I will not give that all away because we want you guys to come to the community event next Thursday. I will record it, so if for some reason you cannot come, you'll be able to catch the recording, but it should be a very valuable and informative talk. So we're hoping, bring a friend, bring someone who is like your accountability person or your fitness person, and we look forward to sharing that with you guys all. So that did go out in the email on Tuesday this week that I send out. We are sharing it on social media. We do like people to RSVP because it helps us prepare the space. So let us know if you plan on coming. I think that's all for the announcements. So what I wanted to talk about today, now Lindsay did ask a question about scoliosis in the group just prior to this talk. And I'm going to do some thinking on that, and I'm going to do some collaboration with Raven. And we will get back to you on what can be done for somebody that has scoliosis, whether that be mild or moderate or severe scoliosis. There are definitely some exercises and stretches and strengthening things specifically for that diagnosis that can be helpful. So we will look to bring that to you guys probably on the next Friday Live. Always welcome questions. Thank you so much for giving us something to share with you guys. I wanted today to give you my perspective on, when should you see a massage therapist if you're getting physical therapy? I've gotten this question from several of my patients. A couple of them are our wellness warriors. And for those of you that don't know what that is, our wellness warriors are the patients who come to see Raven or myself once a month because they value having a relationship with somebody who knows them and their issues and their body. And a lot of times those sessions are highly manually therapy based. And so those patients, I think, are sort of wondering like, well, could I still see Lindsay? Like, would it help me to see Lindsay? Am I cheating on Jen and Raven if I see Lindsay? And I just wanted to sort of answer those questions from my perspective. Lindsay spoke a few weeks ago from her perspective, more along the lines of like what it is that we do, sort of what the differences are. I wanted to give you that from my perspective as well. So both physical therapy and massage therapy use manual therapy. And both Raven and myself are very strong manual therapists. So when you see us in therapy, you're going to receive a large portion of time focused on manual therapy. In physical therapy, manual therapy is one of the tools that we use after we have fully evaluated you. We've come up with a physical therapy diagnosis. We've told you what your problem is, what's causing your pain. We've given you control and ownership of it, and you've got some exercises that you need to do to focus on your posture, strengthening or stretching the areas that are involved. And then we will use manual therapy to help us. It's the tool that we use to help us assist in pain reduction, range of motion, recovery range of motion, improving circulation and blood flow. So that sort of is in a nutshell the gist of, the sequence of events. And I'm looking at my notes. You guys, I know you know that I like to have some thoughts down on paper. So in physical therapy, the manual therapy that we do is very much targeted locally to the problem that you're coming in to therapy for. So if you're coming in for a foot and ankle issue, then the manual therapy that we do is going to be focused around your foot and ankle joint most of the time. We may go above or below it a little bit. If you're coming in for a shoulder pain, the manual therapy that we do is going to be localized around the shoulder region. Some of the tools that we use in manual therapy as physical therapists are soft tissue mobilization, which is just using our hands to move your soft tissue around in a very specific way. We will do trigger point release, where we look for an active or not so active trigger point in your tissues, and we use a sustained pressure to try to get that to sort of melt away like butter. We may do scar tissue mobilization. That's not very much appreciated by the patient, but highly effective. Myofascial release, which is a very big umbrella of a myriad of different techniques that we use our hands largely to stretch your soft tissue, and it takes time, so we allow for that time to happen. We may use tools like Raven's Graston or my scraping tools. I can't call it Graston because I'm not certified, but I call it instrument-assisted soft tissue mobilization, and dry needling would fall under manual therapy also. So those are the tools that we use as physical therapists when we're performing manual therapy. I would say that most of our patients report that when you are receiving manual therapy in physical therapy, it hurts. That it doesn't have to necessarily hurt, but that it can. And most of my patients will say, and I will guide them so they understand, it needs to feel like a healing hurt or a good hurt, because we're putting pressure into an area that isn't moving well and is tight and restricted. And to get that to move, we often have to give it some pressure and encouragement, and there's tightness and discomfort in that, but it should feel like a healing hurt until it is released. And so that is sort of the physical therapy side of, manual therapy when you're going to physical therapy. It's a good hurt as we focus locally to improve your soft tissue and decrease your pain. Physical therapy. Anybody have any questions about that part so far? Feel free to comment below. So in terms of manual therapy, what you're going to get, especially when you see a licensed massage therapist such as Lindsay, you're going to get a more whole body experience. And for those of you that have seen Lindsay, you know she's skilled at that from the moment you walk in her space, it is a healing space. Now, we like to think that the treatment rooms at Fit for Life are healing also, but Lindsay has a beautiful, safe space that just kind of welcomes healing when you walk in her room. She will use similar tools. She will use some of the tools that she mentioned above, but they are, there are some certain things they can't do. I do not think that massage therapists can do dry needling. She'll have to confirm with me about that. There are things that Lindsay does that we don't do. So, and she would have to comment on some of those things too. But as far as like soft tissue mobilization, trigger point release, myofascial release, those she has the capability of doing those tools, but the massage leaves you feeling overall relaxed and refreshed. It's more of a whole body experience. They can do local deep tissue releases also. So let's say you're coming to see us for an issue with your shoulder. She can focus more time and attention on the shoulder than we might have in therapy because we're addressing other treatment tools as well. And then she can go a little bit deeper if necessary on the areas that we're working on. And then she can also give you general recommendations for stretches. She cannot make a diagnosis though, per se, that something is going on. And the good massage therapists that I know and have worked with, they know when it's kind of time to refer somebody back out to physical therapy. They do a great job helping overcome some pain problems for people. They also need to know and should know when it's time for them to refer to somebody else because what they're doing isn't helping enough. So the beautiful part about Lindsay being at our clinic is now most of the time she's seeing patients coming from Fit for Life to her, but as her practice grows, she's going to have, patients coming in from outside that find her. And then it can be a two-way referral process. When you have that sort of a beautiful situation, like Lindsay mentioned, her and I collaborate. Raven and her collaborate. And so when she sees one of you guys, she's going to have a lot of insider information about what we believe and understand to be going on with them medically, physical therapy wise. And it's just going to be a shorter learning curve for her to help you feel better. So they can help work on areas that we don't have enough time to treat or that are sort of connected to the areas. Because as we know, you're a whole body system. So if we're focusing on, your, your hip and back or pelvis, that work that we're doing there may cause your posture to change, and then you're going to have some upper, tension in your neck. So she would be a phenomenal resource for that. So I hope that was a sufficient explanation for sort of the differences and similarities, and when maybe it would be beneficial for you to see Lindsay while you're seeing Raven or myself. If you ever are questioning that, then just ask us. And the other thing that I would say, and this has happened already, is one of our past patients came in a couple months ago and she said, "Hey Jen, I'm having this new problem, in my hip, my back feels like it's tightening up. Who should I see first? Should I start with Lindsay or should I start with you?" That was a great question because we talked through it and together we made a decision about where she should start. And so if you ever are questioning who should you see, because both could be helpful, then just ask us, because we'll be able to talk you through that and get you feeling better quickly. So I hope that answers sort of that question for you. I hope everybody enjoys this weekend. Hopefully we stay dry, and thank you guys so much for walking this journey with us. We are honored and thankful to be part of your journey to help keep you fit for life, and we look forward to seeing you all in person or virtually here soon. Thank you.